Professor, physician, epidemiologist. I am Dr. Shree Banerjee. Belief model. The health belief model is one of the fundamental models in public health. This is widely used in many applications, and I'll be going more over this. But for starters, it's important to note that this model is actually something that was conceived in the 1950s. And so this can be seen as a heuristic sort of model because of the fact that you can use it quickly as a mental shortcut to come up with solutions to public health problems that may be going on within the community. More recently, this has been applied within the context of coronavirus risk mitigation. And I'll be going over that a little bit as well. But first, let's focus on the threat perceptions that is central to understanding the health belief model. Uh, when a person is trying to make a decision on a sort of behavior, engaging in sort of behavior, they have these perceptions, and based on the severity of that threat and what that threat is, so the perceived susceptibility from that threat, a population or an individual makes a perception, um, and they perceive this. And so what do they do as a result is individuals and populations try to determine what the perceived barriers are when they do try to engage in some sort of action, and what are the perceived benefits. So within the context of STI research, or HIV prevention, condom usage, the benefits and barriers can be applied there. In terms of the pandemic, when we're thinking about mask wearing, the perceived benefits and barriers have been assessed within studies that have been conducted within the past couple of years. So, what is all of this amounting to? Um, is an action, but there are certain modifying factors we have to take into consideration. And this is key, and I talk about this in the context of conducting research because there are certain gender-related issues, age-related issues, which may modify the likelihood of taking an action or not taking an action. In addition, there are certain psychosocial sort of elements that may be going on that may modify this. So, all important factors to keep in mind. And when we think about what this results in, all said and done, that results in the likelihood of taking action. Now, this was the original model that was created within the 1950s. It took 3 to 4 decades before we realized that there were multiple things that could be modifying that action likelihood. And one of those things is cues to action. So mass media, social media campaigns, we're seeing the impact of that in real time now more than ever. So these factors were incorporated later on. And then self-efficacy, the likelihood of taking that action and the confidence that you will be taking that action is what self-efficacy is. So these are all very important. So the areas that are just summarizing the key elements are threat perceptions, and then, of course, likelihood of action. But modifying areas are demographic and psychosocial aspects. And then that allows you to take action, but then you have to be thinking about self-efficacy and cues to action. And so this results in understanding what motivation actually is. So that sums up what the health belief model is all about. Now, if we are to think about what the health belief model is missing out on, there are multiple areas that I'll be showing you where there are weaknesses. So the first part of this is looking at how the self-perception theory actually contradicts to a certain level what the health belief model is. So the problem with the health belief model is that it's leaving out a key element in all of this. And here I will draw out specifically what is missing within the health belief model. So over here, so this is a benzene ring. And so this is a 6 carbon ring. And then if you think about the 2 carbons and then an amine group, and then 2 hydroxyl groups. Can anybody think of what this compound is? If you think or set to yourself dopamine, then you are correct. So dopamine actually destabilizes the whole health belief model. And so if you think about what this does and what this means is that you want to be also thinking about how certain actions and how certain reactions create certain emotions and create certain behaviors. So if you're thinking about addiction, a lot of times the reaction or the action is not uh, really as a result of any cognitive sort of patterns, but also addiction patterns, which are guided by dopamine and the reward pathway that is being created from that within the substantia nigra. One of my first experiences after college was working with this dopamine pathway and better understanding how the circuitry works. So it's really important to note that if you're thinking about the health belief model, and the areas that are not quite emphasized is the emotions and how people's reactions to those emotions um, formulate the threat perception as well. And so this arrow should actually be going both ways and be bidirectional. And this is what I've shown within this model. So this is a bidirectional sort of approach on on this arrow right here and then this arrow right here. So please pay close attention to that. Transitioning from this model to another model that could be potentially seen as a complementary model is the terror management theory. And so this theory created a model that is more geared towards disaster management and can be uh, understood in the context of the health belief model. So let's go through some of the details here. And what I did here for the sake of simplicity, I created this model so that it looks similar to how I created the health belief model. So let's take a look. Again, this should look familiar to you because I start off with the threat perceptions. But what is different is what are included within the squares inside. As you can see, this is proximal defenses and it says distal defenses. It may not make sense at first what this means in terms of threat perceptions, but if you understand this within the context of something called existentialism, this might be a term that you may be familiar with, or this might be something that you might be hearing for the first time, but there are some philosophers that have been attributed to the existentialist philosophy. It's a philosophy, it's a movement, and there are a lot of theories, but the fundamental theory is this, that there is a sort of existential angst that individuals and uh, people go through when they are experiencing a threat to their survival. So automatically, they are getting anxious about the idea that uh, that they're not immortal, and that at some point that they are at some point they will cease to exist. And so there are quite a few defenses that are created as a result of this. So if you think of the threat perceptions as not really threat perception, but more of a mortality salience, that's the terminology that is being used within this theory. But importantly, it's the idea that the fact that we will not exist at a future date. So what are some of the uh, proximal versus distal defenses that are created? One of those would be considered um, a defense, which is denial. And so the fact that, mortality is something that is inevitable, the first defense is that to deny that fact. Of course, then you would, or the individual tries to distract about the notion and look for other ways to try to cope with that. And then, of course, rationalize. So these are the three defenses. And then distally, and distal defense is what is important, is that these are subconscious. These are aspects that humans are not quite consciously aware of, but still are guiding their thought processes. So the worldview defense is extremely important because the individuals try to identify more strongly with their in groups and less with out groups. And if we think about social psychology as it pertained to mass wearing, this was seen so commonly within society. But also the self-esteem striving portion of this, which I'll be going over a little bit more as a potential solution, is good um, areas to keep in mind. So this, of course, determines action likelihood, and this, of course, is very similar to the health belief model in that regard. But again, revisiting this notion of self-striving, self-esteem striving, I think it's really important to think that we want to take people away from this angst. And so in the health belief model, that anxiety was from the threat perception, but here it's the perception and threat perception of mortality, which is the central theme. And so if we can take the individual and take people from this meaningless universe to a valuable contributor to a meaningful universe, this can allow for better sort of management of risky behaviors. Again, existence precedes essence. That is the theme for existentialism and existential angst and terror management theory. So Soren Kierkegaard is attributed to this, but others as well. So if you think about this theory, and if you want to use something that is pertaining to health belief model, but a little bit more modified, then be thinking about either self-perception theory as an enhancement, or also terror management theory as an enhancement, or a combination of all of these in order to update what has been presented within the health belief model. I hope this video has helped you understand the health belief model a little bit better and contextualize it in understanding more modern frameworks that have come up more recently. Thank you for listening.